That paralysis thing. Guy can't walk for 2 years. Nobody knows why.
This is a simple case of lobar pneumonia. Boring.
But that not walking thing, that could turn into something serious. Multiple treatments, multiple surgeries, making real progress. Fixed everything but the leg.
So, what are his stats?
Staying in the 90s on the nasal cannula.
Coughing up much sputum?
Almost none. He seems to be stabilized.
Okay, let's keep him on the broad-spectrum antibiotics. And since he's displaying septic physiology, draw blood for adrenal and thyroid function.
So the patient is displaying septic physiology, and the informant says draw blood for adrenal and thyroid function. Now I agree with the broad-spectrum antibiotics for someone presenting with sepsis. Remember, sepsis is defined as 2 or more SIRS, systemic inflammatory response syndrome criteria, plus a suspected or confirmed underlying infection. Now SIRS is diagnosed if you have 2 or more of the following 4 criteria fulfilled. Usually it's temperature greater than 38 Celsius or less than 36, heart rate greater than 90, respiratory rate greater than 20 or PaCO2 less than 32, white blood cell count greater than 1200, less than 4000, and or greater than 10% band cells. Now note, the 2016 Sepsis 3 consensus discourages the use of SIRS criteria to define sepsis as they have low specificity. Really, the parameters can be positive in multiple other critical illnesses that are not related to systemic infection. That's why they say it has pretty low specificity. But nevertheless, it remains pretty commonly used in clinical practice in the US, unfortunately. Really, it's better if you use the Sequential Organ Failure Assessment Score, or the SOFA score, to kind of really quantify a patient presenting with sepsis. Now,